Hi there! We are the LOPERAMIDE team and we are an antidiarrheal medication.
The generic name is loperamide and the brand names are Imodium, Peptodiarrhea Control, and Cowpectate.
I am therapeutically classified as an antidiarrheal, which means I provide symptomatic relief for diarrhea. In pharmacologic classification, I am gastrointestinal agents opioids.
Pregnancy category of loperamide is B, and there are adequate studies that prove no evidence of risk to the fetus and the pregnant woman.
Now let's go to my mechanisms of action. I act by slowing down intestinal motility and by affecting water and electrolyte movement through the bowel. I inhibit peristaltic activity by direct effect on the circular and longitudinal muscles of the intestinal wall. Non-selective calcium channel blocker binds to opioid mu receptors. Evidence also suggests that in higher concentration, it binds to calmodulin.
Administered orally, the onset is 30 to 60 minutes, 1 to 6 hours is its peak, and the duration is 4 to 5 hours. The first phase is 6 hours, while in the second phase is 1 to 2 days. Loperamide is metabolized in the liver and excreted through feces and urine.
These are my indications. I control and provide symptomatic relief of acute non-specific diarrhea and chronic diarrhea associated with inflammatory bowel disease. I reduce the volume of discharge from ileostomies. I am also used as an OTC drug for diarrhea, including traveler's diarrhea.
Loperamide is contraindicated to the patients who are allergic to loperamide since it can cause hypersensitivity reactions. Also contraindicated to patients who must avoid constipation, as one of the adverse effects of loperamide is constipation, and to the patients with diarrhea associated with organisms that penetrate the intestinal mucosa, like the E. coli, Salmonella, Shigella, and Clostridium difficile.
These are my side effects. In the central nervous system, the side effects are tiredness, drowsiness, and dizziness. In the GI, the side effects are toxic megacolon in patients with ulcerative colitis, abdominal pain, distension or discomfort, constipation, dry mouth, nausea, and vomiting. In the blood, the effect would be myelosuppression. In the respiratory system, the effects are pulmonary infiltrates and pulmonary fibrosis. And on the skin, there would be rashes. Now let's talk about the nursing responsibilities.
Before administering the drug, assess for any allergy to loperamide. Patients who must avoid constipation and diarrhea associated with invading organisms. Assess skin color, lesions, orientation, reflexes, abdominal examination, bowel sounds, liver evaluation, and serum electrolytes.
During drug administration, first is to monitor for response. If improvement is not seen within 48 hours, discontinue treatment and notify health care provider. Next is to monitor the patient for diarrhea and abdominal pain. Next is to monitor blood counts before, weekly, during, and 6 weeks after use. Monitor pulmonary function often. Then, have the opioid antagonist naloxone readily available in case of overdose and CNS depression. Provide comfort and safety measures to help client tolerate the effects of the drug. Then, educate the client in drug therapy.
After administering the drug, monitor for serious adverse effects such as abnormal heart rhythms in patients taking loperamide and notify the provider immediately. Evaluate for dehydration continuously until the condition resolves, and monitor clients' compliance to the drug therapy.
That's all. Thank you.